Hello.
Hi, Liza. This is Nancy Allen.
Hi, my name is Linda Richard.
My name is Jennifer Beard.
Okay, I don't think everyone needs to sign in. I think that PTCB is going to take the mic here and open up. I see.
Hi, Nancy. It's Liza. Can you hear me?
We can hear you. Yeah.
Okay. We have about 2 more minutes till the top of the hour, so we'll wait another moment or two to let people dial in. Okay, Nancy, it's 5 p.m. I will go ahead and turn things over to you, and then we'll get started.
Okay. Well, I want to welcome everyone to our webinar today that's co-sponsored by the National Consortium for Health Science Education, as well as the PTCB, the Pharmacy Technician Certification Board. We are honored that the PTCB joined our organization as a professional association. They joined us in the fall of last year, and so we're looking forward to having them as a partner with us. And one of the benefits of them being a part of our organization is to be able to provide this free webinar to you as classroom teachers or health science state leaders or others who have an interest in what's new and exciting with the PTCB. So we appreciate their willingness to provide this webinar. We did one yesterday. It was a great success, and we know Liza will do a great job today. Just wanted to also mention that they came on board with us through a relationship with Pass Assured. They are an online curriculum provider of pharmacy technician training, and they had suggested that PTCB partner with us to have access to high school teachers, high school programs who delivers pharmacy technician training. So we are excited to have them with us. We also look forward to having them at the 2019 National Health Science Conference, which will be in St. Louis, Missouri, November the 6th through the 8th. So if you happen to be coming to that conference, they will have an exhibit space there, and we'll look forward to meeting you face to face and also answering any more questions. So with that, I'll turn it over to you, Liza, and we welcome you and appreciate you providing this opportunity for our teachers and health science state leaders.
Well, thank you, Nancy. And at PTCB, the Pharmacy Technician Certification Board, we always welcome the opportunity to be able to share our message, particularly with educators, because you are so important and vital to the success of our organization, because you are on the front lines of training well-training technicians to work in the workplace and to expand the profession of pharmacy. So again, thank you very much for the time today and for the introduction. Just to go over a few housekeeping notes, we will be emailing the slide deck out to you later on this evening. We are recording today's session, so if you have any need to review the session again, it will be available for you. And then also, we did record yesterday's session too. If you want another vantage point, my colleague Ryan Burke was the presenter of yesterday's presentation. But we do have a chat function. And so what we're going to ask is at the conclusion of today's presentation, we will be taking your questions via chat, as we have muted all lines just to keep things quiet and everybody can concentrate on the content that's being delivered today. But again, thank you very much and welcome to each of you. And again, we appreciate your time this afternoon. So what we're going to review today, I'm just going to give you some basic information about PTCB, who we are and what we do. We are going to talk in detail about our new education and training requirements, the eligibility pathways that will be taking effect in January of this upcoming year for students, candidates to be eligible to sit for the PTCE, the Pharmacy Technician Certification Exam. I will be providing you with an update of those things that are changing on our exam. Our exam has been in its current existence since 2013. And so right now we are taking the 2.0 exam, our students are, our applicants are, and so that exam will be changing also in January, and we call that the 3.0 update. I will share some information with you, as many of you may also be certified pharmacy technicians, that we are having an update to our recertification process. And then I want to give you a preview of some things that we have in the works at PTCB, some new up and coming exciting programs that we'll be launching next month. So just to give you an overview of who the Pharmacy Technician Certification Board is. We are a nonprofit organization and we do one thing. And that one thing is advancing medication safety by certifying pharmacy technicians. We were founded in 1995. So next year in 2020, we will be celebrating our 25th anniversary. And we're very excited. We have some different activities in the work to celebrate pharmacy technicians next year that we will share throughout the upcoming year. But what we do, and we do it so well, is that we set the standard for certification for pharmacy technicians. And so again, technicians are our mission. That is the one stakeholder group that we hold near and dear to our hearts, that we're working on their behalf. So to give you an overview of just what we've done over the past 24 years, over 676,000 pharmacy technician certifications have been awarded. Currently, we have almost 290,000 active certified pharmacy technicians. And you might think, well, there is a big difference between the 676,000 and the 288,000. But as we all know, pharmacy technicians may choose a different career path. They may choose to go and continue their education and go into other healthcare professions, or leave the pharmacy profession altogether, or they may even pursue to become a pharmacist. So that is the reason why that number is what it is, because many people choose not to stay in the profession. But we are very proud of the fact that we have 290,000 technicians certified throughout the United States. Just last year, we almost administered 49,000 CPHT exams. And where are those exams administered? They're administered in a secure testing environment at Pearson VUE centers throughout the country. And the examination is administered and accepted in all 50 states and our territories. And you will even notice that PTCB is included in some of the regulations in over 45 states and the District of Columbia. And that is one thing that we do at PTCB. We are in constant monitoring of what states allow in the regulations for pharmacy technicians to be able to do to advance their careers and also to assist in the profession of pharmacy. So just to give you an overview of by the numbers. So according to the Bureau of Labor and Statistics, their 2017 survey, we see that there are about 417,000 pharmacy technicians that are currently identifying themselves as technicians in the workplace. So just think about that. Many of you, as you probably walk into your community pharmacy on a regular basis, or if you have been in a hospital or health system setting, you've probably encountered a pharmacy technician. Many times we encounter pharmacy technicians before we even encounter a pharmacist. So technicians are definitely a vital part of the profession of pharmacy. And I, as a practicing pharmacist in my previous career, I will tell you the lifeblood of the pharmacy in which I managed were my pharmacy technicians. I could not do what I did every day in the community if I did not have well-trained pharmacy technicians. And so about 73% of pharmacy technicians identify themselves as working in community practice. About 25% are working in a hospital health system practice setting. And then that other smaller number identify themselves working in administration or working in government regulatory agencies or even pharmaceutical companies. But just want to share with you, there are advancing technician roles that we have identified at PTCB. Most people think that a pharmacy technician, as I mentioned earlier, are working behind the counter, assisting with dispensing of medications or answering the telephone or assisting with insurance questions. But we definitely have identified the list is growing of innovative technician roles. Many technicians are seeking this as a career-long opportunity, a lifelong profession. And so just to share with you some of the things that we have had encounters with technicians that are certified through PTCB. Many of them are now working in administration. Some of them are serving on boards of pharmacy. If you look down farther into the list, immunizations, if any of you are currently residing or working in Idaho or Rhode Island, those states now allow pharmacy technicians to assist with the administration process of vaccines. Also, medication therapy management, medication reconciliation, medication history. Even in some states, point of care testing is allowed to be performed by pharmacy technicians. So what we think about as being a pharmacy assistant 50 years ago, working as a clerk in a pharmacy certainly has changed throughout the years and the generations. And that's particularly because of all of the education and training that these technicians are receiving. So to advance into the eligibility pathways, as our exam is changing beginning in 2020. So currently for a technician or a student or a candidate to be able to apply and sit for our exam today, the only requirement is that they have a high school diploma or an equivalency. But that will be changing in a few months. The eligibility pathways, there are two. So one of the two should be attested by the pharmacy technician as they apply for the examination. One is completion of a PTCB recognized training program. And I'll be sharing more information in just a few moments about that process and how an organization, a high school, a post-secondary school would go about becoming a recognized training program. And then the other eligibility pathway is a work equivalent pathway. And at PTCB, we've identified that to be 500 hours. And we did receive a great question yesterday from one of the webinar participants. What does that work experience entail? If someone is on a rotation or they're doing an internship, can those hours count toward the 500-hour work equivalent? And yes, that those hours don't have to be someone specifically on the time clock, punched in, working, and being paid for those hours. If they are completing internship hours, that can count toward the 500 hours as well. And we're going to discuss in detail today the required knowledge, as this will be a requirement for both pathways in which candidates are seeking. So specifically discussing the training requirements, recognized programs must include specific knowledge in their curriculums. So I'm going to share with you our content outline for the upcoming exam, as well as a knowledge reference guide. And the process is for the program director of the education training program to go through those two documents and attest that your program curriculum is meeting those requirements. The process is very simple. There's a nice form that you complete online. There is no charge to become a recognized training program. And we will share with you the links to the content outline later on, and we'll send that out to you this evening. Just to let you know that all ASHP, ACPE, and ABHES accredited programs are automatically recognized. And so ASHP, ACPE, that might be a new organization for some of you, but that's the American Society of Health System Pharmacists, who works collaboratively with the Accreditation Council for Pharmacy Education. They have a very rigorous accreditation process that many training programs undergo. And then the other accrediting body for technician training programs is ABHES, which is the Accrediting Bureau of Health Education Schools. So those programs that have gone through that accreditation process are automatically added to our recognized list. As I mentioned, the program directors of non-accredited programs must complete a self-attestation. And just to remind everyone, an attestation is very different and separate from accreditation. And we began the recognition process earlier this year, and we are proud to say that we are approaching 1,000 programs that have completed the recognition process as of today. So what types of programs can seek recognition? Of course, certificate and degree programs, College of Pharmacies associated with technician programs, employer training programs. We have many employer of technicians that have their own training and education content, as well as high school programs, which many of you can identify with high school programs, and then also military training programs are going through the recognition process at this time. And I will note, you see our logo here, Recognized Education Training Program. Once you've completed the attestation process, we are allowing and asking our educators to display the Recognized Education Training Program when it's applicable. So to go through the content outline and the knowledge reference guide, and yes, they are two separate documents, but for time today and simplicity, I just wanted to share with you the knowledge reference guide. You will notice the blue highlighted column that has all of the content outline that is listed there. So as you will see, the knowledge areas that are covered over the PTCE exam, or the Pharmacy Technician Certification exam, those areas are listed here in blue. And then also, and it will display much clearer on the next slide, and I'll go ahead and advance to that. The white column, those are also required areas that will be completed through the education and training programs and the work experience Those are also requirements for a program to oversee in their curriculum, part of the recognition process. And then that gray column are recommended areas, knowledge areas that is very important for pharmacy technicians to be exposed to, but not necessarily required for the recognition process. So again, these documents, we will be sharing links with you later on today if you have not had an opportunity to review them. So as I mentioned earlier, submitting the attestation form is very clear, concise, and a simple process. So all you do is visit our web link, attest.ptcb.org, and how this process is occurring. So if George Washington High School program director is attesting today, we will receive the form, and we update our list of the recognized training programs monthly. So you would not see your program listing on our website until probably the first 2 weeks of October. So we do update the list monthly, just letting you know it's not an instantaneous process for your program to be listed on the website, but we will certainly work to get that uploaded in the next month after we receive your attestation. And again, it is going to be an interactive directory that will be launching next month. We are launching a new website. At this time, it's just simply listed the programs on our website, but we're looking forward to having a new website where your program would be listed along with a link to your website that those looking for education programs can easily find programs in their state. Now, just to dive in deeper into the upcoming exam, as I mentioned, 3.0, that's an internal label for our staff at PTCB. And as I mentioned, the exam that is in its current state was updated in 2013. And so based on a job analysis of surveying over 40,000 pharmacy technicians that was completed in 2016, we identified our new blueprint and the content outline and that knowledge reference guide, as we shared with you, that is more focused on key areas that are relevant across practice settings. So our exam is becoming more practice setting neutral, where it's not favoring one profession or one aspect of the profession or one facet of the profession. It's very neutral to both community and health system practice. And again, as I mentioned, the implementation of the new exam will begin in January of this upcoming year. So currently the exam has 9 focus areas or 9 knowledge areas where test questions are derived, but the new exam is being focused on 4 knowledge areas. 40% of test questions will be focused on medications. 13% of test questions will focus on federal requirements. Then patient safety and quality assurance will make up 26% of the exam. And then for order entry and processing, that will compose 21% of the questions. And again, this is just another link to the crosswalk and outline of the new exam that will be launching. So as I mentioned, the exam is going to contain the most important content that is relevant to the major areas of practice of pharmacy. So as you will see here, there is overlapping information from both health system and community pharmacy, but you see the outliers such as Joint Commission, state law, regulatory information at the state level, sterile compounding preparations. Those are outside of what will be covered on the PTCE, but again, that is information that is covered in on-the-job work experience. Where on the community side of practice, where we have wellness, immunizations, point-of-care testing, those types of things that are covered under wellness opportunities, yes, that is covered in on-the-job training, work experience, and then billing and reimbursement is covered through a day-to-day work experience of a pharmacy technician. So those items are not necessary, they will not be tested on the exam with our new changes. And just to share with you information about our recertification process. So once a pharmacy technician becomes certified through PTCB, they must recertify every 2 years to maintain their certification. And so what is involved in recertification? This is a very easy process now, and that we're very excited. As a pharmacy technician, you must complete 20 hours of continuing education requirements during that 2-year period. One of those hours must be in patient or medication safety and the other in a law update. But the other 18 hours are very, can be to the discretion of the pharmacy technician. But in the past, a pharmacy technician, when they were recertifying, they had to actually enter in all of the CPE codes into our system. But now we are integrated with NABP, the National Association Board of Pharmacy, their CPE monitor system, where information is more readily available, electronically available. So a CE provider would upload that information into a pharmacy technician's profile through their e-profile number. And that way we are able to look into their system and be able to manage this recertification process much easier than it has been in the past. So we're very excited about this new streamlined process. And just to give you a look ahead of what is coming from PTCB, we're very excited. We will be launching next month. In addition to our new website, we're going to be launching an assessment-based certificate program as well as a CPHT advanced credential. And so just to give you some background information of the assessment-based certificate programs, this idea came about because we listened to pharmacy technicians at PTCB and they're wanting more, looking for ways to expand their knowledge areas, looking for ways to validate their levels of expertise. So we have developed a certificate program where education and training is a requirement or a work pathway eligibility process along with an assessment. So PTCB is creating the assessment where we are partnering with education and training providers. It'll be very similar to the PTCB recognized training program list for the CPHT, but more specialty in the area of the identified certificate program domains. But the first 5 certificates that we'll be launching, the first 2 in October this year, Technician Product Verification, or some of you may know that as Tech Check Tech, Medication History, and then later before the end of the year, we will also be launching a Hazardous Drug Management Certificate program. And then to come in 2020, we will have the programs and assessments specific for billing and reimbursement, as well as controlled substance diversion prevention. And then these are just the first 5 certificates that are on our timeline. There are more to come, and maybe next year we'll be able to provide another update to the Health Consortium to be able to share more of our assessments that will be launching in the near future. But just to let you know, the eligibility criteria to be eligible for the assessment-based certificate programs as well as the CPHT advanced credential, you must be in an active PTCB CPHT who has completed the PTCB recognized education training program. And again, as I mentioned, some of these programs will have an alternative eligibility pathway that it will be a work experience pathway. So this is just an overview of the information I shared with you, but also expanding on the CPHT Advanced. In order for someone to be awarded the CPHT Advanced credential, in addition to being an active PTCB certified pharmacy technician, someone would also have to successfully complete at least 4 of the certificate programs And one of those programs must be the Technician Product Verification Assessment or the Medication History Assessment. And then also to have at least 3 years of work experience in the last 8 years. So these individuals who earn the CPHT Advanced Credential, they will also be required to complete additional CE hours to maintain their certification. So again, we are very excited about this announcement because, again, this has another opportunity for pharmacy technicians to rise to the top and show their level of expertise. And again, creating a career ladder, a lifelong career opportunity for technicians. So this is just a list of the resources that we have discussed with you today. The link for the attestation, also the recognized program listing, as well as the blueprint, the knowledge reference, and the crosswalk. So there's no need for you to write these down. We will be sharing these with you shortly at the conclusion of our program. And then lastly, just want to bring to your attention that Tuesday, October 15th is International Pharmacy Technician Day. As many of you are probably aware that the month of October is American Pharmacist Month, but we want to call out a special day specifically to celebrate our pharmacy technicians, because pharmacy technicians make the world go round as you're practicing pharmacy. If you're operating a pharmacy of any type, technicians are vital to the success of any pharmacy in maintaining patient safety and ultimately taking care of patients. So if you are in a pharmacy that day, please stop by the pharmacy and wish and congratulate the technicians that are working that day, or even share this with your technicians in training, because this is a fun and exciting day to celebrate the work and success of pharmacy technicians. So without further ado, we will now open up the chat function and allow you to ask your questions today. So we'll give you just a few minutes to type in your questions, and we will answer those as they come through. So the first question are, how many classes are considered a certificate program? So and I'm sorry if I didn't explain this well, the certificate programs are very specific to the knowledge areas in which they're covering. So depending on the education and training provider, it may be an online training program through an LMS, or it could be a live continuing education program, or it could be a self-study. So it's very specific to the content developer of how many modules or areas in which they're covering for their certificate program. The next question is, I've applied for recognition and neither time have I received an email or notice. So Christy Miner, we will follow up with you and get more specific information to you about your program. So stay tuned, we'll be reaching out to you after today. So when we say changes are coming in 2020, the changes that we have referred to today in regards to the eligibility pathway, as well as the changes to the exam, the PTCE, those will be beginning in January of 2020. So the next question is, my students work or participate through RX Tech exam. Does this qualify to have them completed a certification program? I am not sure off the top of my head if RX Tech exam has completed the recognition process. But we will check on that, Teresa, and we will get you a specific response to your question. So the next question, if the content is covered, and this is Karen's question, in one course, would that be okay? So yes, Karen, if you're referring to the certificate programs, if the content is covered in one course, depending if that meets our recognition process, of course, we would review that to determine if it would be indeed considered appropriate. So if you are using Pass Assured, then yes, that does satisfy all the requirements for a recognized training program. Pass Assured has completed the attestation process, and yes, they are on our list. So if you are using Pass Assured, your program is recognized. The cost of the exam is currently at $129 for the PTCE, and that will be staying the same in 2020. And someone typed in, Vicki, you typed in, what about NHA? Can you give me more specifics about your question about NHA? And for those of you that may not know, the National Health Career Association is another organization that has a pharmacy technician certification exam. Are there any more questions? So does NHA's training count like Pass Assured? The NHA program has not gone through our recognition process. So at this time, if someone completed that, they would not be eligible for our exam.
Hi, I have a question.
Yes.
My program is articulated with CVS Health, and it is a high school program, and the students do the 100 hours. I'm in Connecticut, and currently Connecticut does not require the PTCB exam, but I've had students take it in the past, and they have passed. But currently it's not mandatory yet in Connecticut. I'd like to do the recognition. My affiliation with CVS Health, does that have any bearing on if the recognition is granted?
Is your content, are you covering your own content in addition to what is covered, say, at a CVS training site?
Yes, my curriculum has been approved by CVS.
Okay.
I teach I teach the classroom, and then the students do have access to CVS modules when they are doing their externship hours. So it's really a blending. I'm here in the classroom with the students, and then they go into the pharmacy, do their hours, and then they receive training on site, work experience in the retail setting.
So if after going through the knowledge reference guide and the content outline, if you feel that your program meets all of these, then yes, you would complete your own attestation process. But just to let you know, CVS Healthcare, they have gone through the recognition process as well. But I would suggest that you complete the recognition process for your specific program.
Perfect, and that's what I'm doing now. Awesome, thank you.
Thank you. Are there any more questions? If not, Nancy, I will turn things back over to you.
Okay, you see there on the screen, I'm Nancy Allen. I think I didn't introduce myself. I serve as the Executive Director for the National Consortium for Health Science Education. You see Liza's credentials there, and I failed to thank her for this work. And she is a pharmacist. You see, she graduated from Mercer University. I think you could probably tell that she's from Georgia, as you can tell that I'm from South Carolina as well, but she has extensive work in community practice through the Kroger Company in Atlanta before she accepted this job at PTCB. So we're glad that she's working with partnerships, and we appreciate all the knowledge that she shared today and the fact that she'll be sending out this information to you in a follow-up email. We'll also have this recording posted at healthscienceconsortium.org. So if you need to reference this, but you'll have the slides that she's going to send. So it's our pleasure to offer professional development to you. Look forward to doing other webinars in the future, and we'll have your contact information to be able to share those opportunities with you.
Thank you, Nancy. And I just want to, again, thank everyone for what you do on a daily basis to help train the future of the pharmacy technician workforce. And there's one thing that I failed to mention about the education recognized programs is that throughout, as we are going through the process, adding more programs to our listing, we will have an audit process where programs are randomly identified. As you are now self-attesting, we will be checking in with random selections to make sure that what you have attested to is actually occurring in your classroom. So I'm sorry that I failed to mention that earlier, but I just wanted to make sure that I was able to share that information before we departed this afternoon. But again, thank you so much to the National Consortium for Health Science Education. And again, thank you educators, what you do to help train our pharmacy technicians, and so that they can eventually become certified in advanced medication safety. So again, thank you everyone, and enjoy the rest of your evening.